Come in.
Hi, my name's Megan. I'll be a PA student with you today.
Hi, I'm Tori.
Tori, nice to meet you.
Nice to meet you.
Alright, so what brings you in today, Tori?
I'm having some tooth pain,
pain?
It hasn't really seemed to go away, so I decided to come in.
That stinks. It's the worst. And then how long has it been going on for?
It's been going on for like 3 days.
3 days?
Yeah.
Okay. Alright. So, first off, how old are you?
I'm 21.
21. Alright, awesome. Best age to be. And then female, gender?
Yeah, I'm a female.
And your ethnicity?
I'm Caucasian.
And are you a student or do you have an
Yeah, I'm in school right now.
Alright, what do you go to school for?
I'm actually in the physician assistant program.
No way, that's
Yeah.
awesome. Great occupation. And then, so, how has your general health been before?
It's
two
been
things
good.
started?
Yeah, no other complications.
Good. And then, are you married?
I'm not married.
No? Alright. So, do you have any kids?
No, I don't.
No? Alright. And then, any significant past medical history that you can think of?
No, I've had a pretty healthy
Pretty healthy, alright.
adulthood so far.
Awesome. Sounds good. And then your birthday?
March 7th, 1998.
Awesome. Alright, so a little bit more about your tooth pain. So you said it started 3 days ago?
Yeah.
Alright. Any events that maybe could be linked to the onset?
Yeah, so I got a root canal.
Okay.
About 4 days ago. So I feel like obviously it has to do with that, but
Yeah.
it just feels like it's more pain than it should be.
Okay. So did they tell you like how long the pain that they thought?
Yeah,
the
so
root
I
canal
have
was for?
pain medications,
Okay.
but I'm not big into taking them,
Okay.
so I haven't been. But it seems like it's kind of like inflamed.
Okay.
So.
Inflamed. Alright. So was it sudden or gradual onset? Was it
Gradual.
kind of gradual?
Yeah.
Alright. So how severe would you say it is? Was it, if you could rate it on a scale from like 1 to like the most pain you've ever had?
Yeah, probably like a 6.
A 6, alright. And then has it just been a 6 for the past 3 days, or has it been like fluctuating?
I feel like it's gotten worse over the past couple
Okay.
days, yeah.
Okay. And then duration of your symptoms, like how, like does it hurt constantly, or
Yeah,
is
it's
it
pretty constant.
Okay. Alright. So is there anything that makes the pain better, or?
I haven't really done anything, but usually drinking like cold things helps.
And you said you haven't taken your pain medication?
No.
Okay. Alright. And then anything that makes the symptoms worse, exacerbates it?
Usually like hot liquids, but I'm trying not to usually drink those anyway because I just had a procedure.
And then how about with eating? What have you been like eating as your diet since I know you just had your procedure?
Yeah.
Is it
I've been trying to eat just like softer foods,
Softer
like
foods?
eggs and stuff.
okay, like eggs, mashed potatoes, stuff like
Yeah.
that. Okay. And do that. Like do they
I
bother
don't
it any more?
irritate it, no.
Okay. Don't irritate it. So it's more just like drinking hot liquids that makes it worse. Okay. And then has anything changed since the onset of the symptoms?
No, it's pretty much
Pretty much the same?
Yeah.
And are there any symptoms that like accompany it? Are you
It kind of like goes to like my jaw a little bit.
jaw? Okay.
And
So
it,
you kind of like jaw pain?
yeah, like it. That's what kind of why it feels inflamed.
Okay.
But other than that, no.
Are you doing with fever or
No fever.
chills, aches?
No.
All right. So you said where exactly in your mouth do you
So
think
it's on my right
begins?
side.
Right.
Yeah.
And do you know exactly what tooth? You don't know.
Just back.
Okay, so like back tooth. Okay. And then so you say it's radiating to your jaw.
Yeah.
And is it just the right side of your jaw?
Yeah.
Okay. And have you had anything like this ever happen before?
No.
Have you ever had any previous surgeries or procedures in your mouth?
I've had my wisdom teeth.
And you haven't had any pain like this before
No.
after it? No? Alright. And how would you describe your pain? Is it like sharp, shooting?
Yeah, it's kind of like sharp.
Sharp? Okay. Alright. And then you said it was like a 6 or 6 or 7?
Yeah.
Alright. And then do any like the symptoms change at all during the day? Like is it better in the morning or at night? Or
I feel like it's usually better in the morning.
better in the morning? And does it keep you up at night?
Sometimes, yeah.
Sometimes. So how many hours of sleep have you been getting at night?
Usually like 6 to 7.
Okay. And then since you just had a procedure, you're probably not, are you working or going to class? Or?
I'm just a full-time student.
Full-time student, okay. So have you been able to rest that much?
I've been trying, but I still try to go to class.
Okay.
It's hard to miss class
in
grad school.
Completely understand. So I know your tooth pain hurts all day, but does the jaw hurt all day as well?
Yeah.
Jaw does, okay. And then how long would you say the jaw pain's been going on for?
Probably just since like yesterday.
Okay. So yesterday. Okay, so the tooth pain's been going on for 3 days and the jaw pain's just for a day.
Yeah.
Okay. Right, and then you were saying that that doesn't hurt all day, does it? The jaw pain? No.
Not really. I mean, it's kind of just goes with the tooth pain.
Okay.
But like I said, it's better in the morning.
Better in the morning. Is it also a sharp pain?
Yeah.
Sharp pain. And then how would you describe that pain?
Probably like a 4.
4, so it's not as bad. Okay.
Yeah.
Right. And then anything that helps that pain, or?
I've been trying to like put ice packs on my jaw.
Okay. And then does it hurt more when you like talk or anything like that, or?
Not really.
Not really. It just kind of goes along with the tooth pain.
Yeah.
All right. So I just have a couple general questions to ask you. So have you had any recent weight change or?
No, really consistent.
All right. So would you say you're at like your usual weight right now?
Yeah.
Yeah. All right. And then does your clothing fit any more tightly or loosely than before?
No.
All right. Any weakness?
Mm-mm.
Fatigue?
Yeah, but I think that's just because
okay.
A lot of things.
Yeah, I completely get that. Yeah, long days. And you said no fever, right?
No, I know.
Right. And then a little bit about your mouth. So your teeth and gums, how are like the rest of them? Is it?
They're healthy.
They're good. Okay, healthy. And then has your gum like bled where they did the root canal? Or?
Yeah, a little bit.
Anywhere else in your gums or no?
No.
Okay, so just at procedure site.
Mhm.
All right. And do you use dentures or
no? I don't.
Any fake teeth?
Nope.
All right. And then what was your last dental examination?
Like 6 months ago.
6 months. And do you ever have a sore tongue?
No.
Dry mouth?
Mm-mm.
Any frequent sore throats?
No.
Hoarseness?
Mm-mm.
No. All right. So that definitely sounds like it's not very fun.
No.
I'm so sorry. We definitely have to figure this out together. So I just have a couple more questions for you.
No problem.
All right. So are you on any medications? I know you said you have your pain medication, but you just
I'm not taking it. And, I'm on birth control.
Birth control? And do you know what it is?
It's the NuvaRing, so there's only the one. I don't know the dose, but there's only the one.
Okay, yeah, we can definitely look that up then. And then any other medications?
No.
All right. And then allergies?
I'm allergic to dogs.
That's not fun.
I know. I have a cat.
You had it. There you go. Good. All right. And then what's the reaction you get when you're around dogs?
I just get really itchy.
Itchy? Okay. And then when did that reaction first occur?
Like 4 years ago.
4 years ago. And then I know you said you were pretty healthy as a child, right? So you haven't had any like past like medical issues when you were a kid, or?
I used to be epileptic.
Okay.
When I was a kid, but it was just childhood epilepsy, so it stopped when I was like 8 or 9.
Okay. And was that from like birth until?
Yeah.
Okay. And then complications with that, or how did it?
It kind of just resolved on its own.
Okay. Good. And then anything else? Any illnesses or
no?
All right. So I have a couple questions. Let me know if you have had some of these diseases: measles, rubella, mumps, whooping cough, chicken pox, rheumatic fever, scarlet fever, polio, diphtheria.
No.
All right. How about as an adult? Have you ever had diabetes?
No.
Hypertension?
No.
Hepatitis? HIV? COPD or asthma? Thyroid disorders?
No.
Coronary disease? Cancer?
No.
Kidney disease?
No.
Or like blood clots?
No.
All right. So have you had any other illnesses as an adult or?
No.
Nope. So just epileptic as a kid, and then you're good now.
Yeah.
Okay. Cool. So have you ever been hospitalized for any reason?
No.
All right. Awesome. And I ask all my patients this: have you ever been hospitalized for a psychiatric reason? Had any psychiatric? No. All right. A little bit more about that. Have you ever self-harmed?
I have not.
No. And have you ever been admitted for a diagnostic or psychiatric reason?
No, I haven't.
You're good. All right. Cool. So then, for accidents or injuries, anything that's happened within the past 6 months or? No. All right. And then surgery is just the root canal procedure.
Yeah, and then I had that wisdom tooth surgery.
Oh, yeah? Okay.
But it was just at my oral surgeon.
Oral surgeon. Okay. And when would you say your wisdom tooth surgery was?
Like 5 years ago.
And then the root canal was like 3 days ago. 4 days ago. Okay, cool. And then no complications for the wisdom tooth?
No.
No. And then complications for the root canal, you would say, yeah.
Maybe.
Just maybe. Could be larynx inflammation. Pain. All right. So I also ask all my patients about their gynecologic history, so if that's okay, I'm going to ask you a couple questions about that. So do you remember when your first period was?
I think I was like 12.
And then how long does your typical menstrual cycle usually last?
Like 7 days.
7 days, okay. So a whole week. And then how long does it last? Like, is it heavy or light or like change?
It's pretty heavy.
Heavy? Okay. Is it heavy the whole week?
Yeah.
And then when was your last menstrual period?
2 weeks ago.
2 weeks. And I suppose you haven't experienced menopause yet?
I have not.
No? And then have you ever experienced like amenorrhea, which is like when you don't have your period for a couple?
No, I get it pretty consistently.
You haven't missed any?
Yeah.
Okay, so haven't missed. And then have you ever experienced like painful periods or really bad cramps?
No.
No. And then have a pap smear yet? Or?
I actually did 2 months ago.
2 months ago. And then do you have any history of any abnormal pap smears?
No.
So that one came out pretty good? All right. So have you ever been pregnant before?
I have not.
No. All right. So you haven't had any abortions or?
No, I have not.
All right. And then do you use contraception?
I do.
Yes. And what's your method of choice?
So I'm on the NuvaRing and then I try to use condoms.
Okay, awesome. And then are you sexually active?
I am.
Yes. Are you sexually active with men, women, or both?
Men.
Men. Right, awesome. Sounds good. And then how many partners do you think you've had in about the past 6 months?
Like 2.
2. Alright, sounds good. And then have you had any history of STIs?
No, not that I know of.
Alright. Second. So I'm going to ask you about a bunch of immunizations. If you remember the date you got them, that'd be great, but if not, we can find it somewhere.
Yeah.
But tetanus?
Yeah.
Yeah? Okay, sorry.
I have that. I don't know like any of the dates.
Okay, yeah, we can find it.
I think I have a copy.
Okay.
But yeah, tetanus I got.
Okay. And then let me know if you also had any reactions to any of the immunizations. So pertussis?
Yeah, I have that.
Okay. Diphtheria?
Mm-hmm.
Polio?
Mm-hmm.
MMR?
Mm-hmm.
Influenza?
Mm-hmm.
Chickenpox?
Yep.
Hepatitis B?
Yep.
Pneumococci?
Mm-hmm.
Herpes zoster?
Mm-hmm.
Meningococcal?
Yep.
And HPV?
Yep.
Alright, awesome. And then for screening tests, I'm going to ask if you got some of those. So have you ever had a TB test?
Yeah.
Yes. Alright, and did you have any positive results? Were they negative?
Negative.
Negative? Okay, awesome. You said you had a pap smear 2 months ago.
Mm-hmm.
HPV screen?
I have not had one of those.
Right. Mammogram?
No.
Nope. Fecal occult blood testing?
Mm-mm.
No. Colonoscopy?
Nope.
No. Cholesterol test?
Yeah, I had that 2 months ago, and it was normal.
Normal? Okay.
Yeah.
A DEXA scan, it measures your bone density?
No.
Lung cancer screening?
No.
Nope. Alright. So for family history, we usually ask for 2 generations above, then 2 below. So
Okay.
your grandparents, but I guess it would stop you because you don't really have any kids.
Yeah.
So how is your family? Do you have any conditions that run in the family?
Nothing that like runs in the family.
So we can start with like your grandparents. Are they alive? Are they passed away?
Only one of my grandparents is alive, and it's my maternal grandmother.
Okay. And then what did your other grandparents pass away?
I think it was just like natural causes. Okay. There wasn't anything.
No underlying.
Yeah.
Okay. No pertinent. All right. And then your parents.
Yeah. So they're both alive and healthy.
Okay.
My dad does have hypertension. They told him he was pre-diabetic, but he's like working on that. And then my mom, nothing that I know of.
Okay, so mom's pretty healthy. And then for your dad's hypertension and pre-diabetes, do you know if he takes any like medication?
Yeah, he does. I think it's managed well. I'm just not sure what medication it is.
Okay. And then siblings, do you have any?
Yeah, so I have a
sisters?
twin and I have
No
two
way.
older sisters. Yeah.
And how are their health?
They're all in good shape. Yeah.
Good shape. Okay. Good. So you don't really have any like conditions that run in the family. Everyone's been pretty.
Yeah, not that I know of.
Okay.
Everyone's been pretty healthy.
All right, awesome. And then no children. So I'm gonna ask you a couple questions. If it like rings a bell or something, let me know if any family member has had it. Headache.
No.
Seizure disorder.
Well, I had the epilepsy, but not that I know of in my family.
Okay. Stroke.
Nope.
Mental illness.
Nope.
Suicide.
Nope.
Substance abuse.
Nope.
Thyroid disease.
Nope.
Coronary artery disease.
Nope.
Hypertension.
My dad.
Yeah. Elevated cholesterol levels.
Nope.
Diabetes.
Nope.
Just pre-diabetes.
Yeah, the pre-diabetes, but no one else has been like diagnosed.
Okay. Asthma or lung disease.
Nope.
Tuberculosis.
Nope.
Renal disease.
Mm-mm.
Arthritis.
Yeah, my dad actually does have arthritis. He has osteoarthritis in his knees.
And then has anyone else in your family had like major tooth pain, you know?
No, not that I know of.
History of cancer?
Nope.
Any genetically transmitted diseases?
Nope.
Alright. Alright, so a little bit more about yourself. Where were you born?
So I was born in Chestnut Hill.
Okay. Not too far from here.
Not at all.
And then what was your childhood like? Was it
Pretty normal.
pretty normal?
Yeah, nothing like outstanding.
Do you and your family get along?
Yeah.
And then, so I know you're still in school now, but what would you say like your last year of schooling is gonna be? Is it?
So
You're
it's
doing
gonna be.
masters?
I'm gonna graduate in 2021.
Graduate 2021 with your masters.
Mhm.
Awesome. And then, have you had any jobs?
Yeah,
pregnant?
I worked at a restaurant for a couple years,
Okay.
but right now I'm not working.
Not working now. Awesome. What did you do in the restaurant?
I was a manager.
Manager. Awesome. All right. So, what's your home and like living situation like now?
So I live off campus with some roommates from school.
Okay.
But my mom and dad are separated, but they both live nearby.
Okay. So how many household members are you living with at school right now?
3 other people.
3. And you guys all get along?
Mm-hmm.
You have good relationships with each other?
Yeah.
And do any of the members at your household smoke?
No.
No. Do you feel safe at home?
Yeah.
At your home, on campus, and also
Yeah.
your home?
All the
Okay.
homes.
And then you said you have a cat, right?
I do.
Right. And then how do you get around? Do you like drive yourself?
I drive, yeah.
Okay, awesome. And then have you had or do you have any significant stressors in your life other than PA school?
Yeah,
or
just school.
Just school? Okay. Awesome. And then have you served in the military or any of your family members?
Mm-mm.
No. And then how would you describe your financial situation?
It's stable. I'm in
Stable,
school.
yeah, debt. I completely understand that. And then what do you like to do in your free time when you're not studying and
just hang out with my
Hang out with
roommates and my friends.
Alright, so just a couple questions about your daily living. So do you bathe yourself,
Yeah.
dress yourself?
Mhm.
Do you go to the bathroom on your own?
Mhm.
And then can you get around within the house easily?
Yeah.
And then do you feed yourself?
I do.
Awesome. Do you use the telephone on your own?
Yes.
Do you shop for yourself?
I do.
Cook for yourself?
Mhm.
Are you in control of like all the housekeeping?
Yeah.
Yeah. Do you have like your roommates help you out with that stuff though?
Yep.
Yeah. Right. Awesome. And then do you do your own laundry?
Yeah.
Do you drive yourself around?
I do.
And then are you in charge of like your daily medicine? Like you take your birth control?
Mhm.
Well, it's the
It's
new
the
rig,
new
so
rig,
you're
but I
good with that.
change it out.
Okay. Cool. And then are you in charge of managing your finances?
Yeah.
And you're good with that?
Mhm, yeah.
Okay, awesome. And then do you have any religious or spiritual beliefs?
I'm Jewish, but
Okay.
it's not a big part of my life. so.
Okay, not a huge part. And then what do you do for exercise?
I usually try to run a couple times a week, but that's pretty much it.
Times. And then, do you have 3 meals a day?
Mm-hmm.
Yeah. And what would you say like a typical day for you is?
I usually just eat like a breakfast bar in the morning
Okay.
before class, a sandwich, and an apple usually is my lunch.
The go-to.
Yes, the go-to. And then dinner changes up, but like pasta or something.
Yeah. Any food restrictions?
No.
And then how about your usual daily fluid intake?
It could be better.
Could be better.
Yeah, but I definitely am trying to drink more water.
How much water do you think you drink a day?
Probably like 50 ounces.
Okay. And then, do you drink caffeine, coffee?
Yeah, I usually drink like 1 to 2 cups a day.
2 cups of coffee, any soda?
No.
Do you drink alcohol?
I do.
Yeah. And what's your alcohol intake like?
Usually just like maybe 2 to 3 drinks a week.
2 or 3 drinks. And do you drink socially or?
Yeah, just socially when I go out.
Okay. And then, what are your sleeping habits like? Have you been getting like good sleep or?
I usually get like 6-ish hours.
6
of
hours.
sleep.
And do you feel like that's enough for you, or do you feel like it's just kind of?
I
school?
prefer more.
Yeah. Okay. But
Yeah.
school, okay. And then do you regularly wear a seatbelt?
Yes.
Even in Ubers?
Sorry, what was that?
Even in Uber?
Yeah.
Yes. Okay. Good. And then do you use a helmet when riding a bike?
I do.
Yes. Do you use sunblock?
I do.
Do you have smoke detectors in your home and apartment?
Yeah, I do.
And then, do you like lock your cabinets for medicine and chemicals?
Yes.
And then, do you have any alternative healthcare practices like natural products, deep breathing, yoga?
I take CBD every day.
Okay. Right. And, so, have you ever smoked?
No.
No. And then, have you ever used any different types of tobacco, like cigars, or?
No.
Have you ever vaped?
No.
Have you ever taken any other forms of nicotine?
No.
And then you said you probably have like 2 to 3 drinks a week.
Yeah.
What kind of drinks?
Usually just like wine.
Wine. And then I know like a glass can be either, like 5 ounces or you might fill the whole thing up. So how much do you think is usually in a glass?
I don't know the number of ounces, but a good serving.
A good serving, okay. Do you use any street illicit drugs?
No.
Cocaine, marijuana, heroin?
Mm-hmm.
Have you ever used any street or illicit drugs?
No.
Do you use any drugs that were not prescribed to you?
No.
And do you ever take more than prescribed amounts of any medication?
No.
Alright. So I know you say you feel safe at home.
Mm-hmm.
So violence is so common in many people's lives, and because there is help available, I ask every patient this question. So within the past year, have you ever been hit, slapped, kicked, or otherwise physically hurt by someone?
No.
Right. And you feel safe at home with your roommates, and if you have a partner, you feel safe at home with them.
Mm-hmm.
All right. So I think that's everything right now, but I definitely will look more into this and definitely figure out what's going on so we can get you back to your great health.
Yeah.
All right. Well, good luck in school.
All right. Well, thank you. It was nice to meet you.
Yeah, you as well.
Oh, it's still on.